This is the second year we are doing this blanket vaccination. That means that we are covering over 95% of the national herd. We want to vaccinate against 3 transboundary animal disease, meaning that they are very contagious disease that can move from one country to another. And due to the crisis in Syria, we are very worried that those diseases could come into the country. Then we are protecting the herd, the national herd, against foot and mouth disease, peste des petits ruminants, and lumpy skin disease, which are 3 diseases affecting cattle, goat, and sheep, and that are very important in terms of productivity. The animals are dying, but also are losing a lot of their production. The disease can kill, a large number of animals, but not only that, and this is much more difficult, can reduce the quantity that the animal can produce, and I'm thinking of milk. Milk is an important food, certainly for children. Having 1.5 million refugees is more people in need of food, and animal protein and milk is extremely important in the food security basket. We believe that by reducing the risk of disease, by reducing the risk of losing productivity of the national herd, you contribute directly to food security in this country. Vaccination is not just buying vaccine and go and immunize the animal. There is first a lot of training, capacity building that's been done. We train over 120 community animal health workers. Those people are now in the field, not only able to do the vaccination, but also looking at the animals and be able to report any disease. We work also directly with the central veterinary officer to create an epidemiology unit to be able to monitor the disease. And as an example, last year we had lumpy skin disease outbreak. We don't have anymore any cases reported. The same for PPR, meaning that not only the vaccine is working, but we do have in place the tools to be able to monitor what is happening and to be able to monitor in the future when a new outbreak from those diseases or other disease will happen, to be able to react more quickly. We also provide feed for the animal along the border to make sure that they continue to produce and produce as much as they can where you have the largest number of refugees. Those people are directly benefiting from the project because they are the one buying and drinking the milk from those herds. Then in terms of feed or food intake, all the animal protein comes from those animals that are protected. We always say that you cannot drink anymore a glass of milk in Lebanon that is not from an animal that's been immunized by this project, and is not only for the refugees, but is for the entire population.